Good morning, everyone. Welcome to the World Diabetes event organized by MDEX, CRNCD, and CEE. Okay, so we are talking about diabetes, and every year there is this World Diabetes Day on the 14th of November, right? So why is diabetes so important? Well, diabetes is important because it's affecting many of us. In Malaysia, the adult population is 19 million, and it affects 3.2 million people. And it's going to be increasing, right? And in 2006 till now, diabetes incidence prevalence has nearly more than doubled. So if we are not careful, we are going to get diabetes. So some of you would too. Okay, and also diabetes in Malaysia is actually one of the highest in Southeast Asia, if not the highest. Okay, so why do people get diabetes? Yeah, there are certain things that we cannot control. One of them is genes, right? You cannot change your parents, too late. And one is age. As we grow older, we also get certain diseases. Diabetes is one of them. However, there are certain things, we call it modifiable risk factors. Modifiable, that means you can change. You can modify your risk factors. I mean, for those who are not medics, risk factors are actually the things that would increase your risk of having certain diseases. So they are called risk factors. So if you have them, you want to reduce them if you can. Right? So what are the risk factors, right? Or how can you prevent diabetes? So you want to prevent it before you get it. So one of them is by leading a healthy lifestyle. And how do you lead a healthy lifestyle? Actually, it's very simple, right? It's very simple. Many things are very simple, but to do it might be slightly difficult. However, if you try bit by bit, then you can actually, do it more and more in your life. So one of them is by healthy eating, right? And so today we are going to have several talks by our experts on diet and diabetes. So healthy eating, and we also are going to sell some, healthy food outside. And actually one of the is also getting the money for helping a charity organization for children. Okay, so please do visit the booth. And also, if you do not know what healthy food is in Malaysia, please visit the booth, because Malaysia is well known to be one of the countries with such delicious food, right? Such delicious, we just love it, yummy. But a lot of the foods are not healthy. So if you can eat it, you eat it with moderation. So like all things, don't say I don't eat it at all, 0%. No, I don't think you should do that. Once in a while, you love to have a big fatty meal, go ahead, then go and do some more exercise. Okay, so I wouldn't touch on healthy diet because it's going to be one of the talks. However, I do want to say something about sugar. Sugar, right? Sugar, we take sugar, and most of us take sugar, and sometimes without knowing it. Okay, so in Malaysia, we have increased our sugar intake from 21 teaspoons, in 2006, to now 26 teaspoons of sugar. A lot of food contains sugar, and sometimes you don't know about it. Our drinks, our coffee, teh tarik, kopi all have sugar. And you say kurang manis, I feel still sangat manis, right? Okay, so how can we go about it? Because I don't think this is going to be covered in our talk, so I'm going to just give you some simple tips, Overseas, in the Western countries, when they make coffee, the mother or the person who makes the coffee don't put sugar in the pot. I'm sure, sorry about that, the organizer, that I think the coffee we are going to serve you probably is going to have pre-added sugar as well, am I right? Because this is the norm, right? This is the norm. So sugar is already added, so I don't take sugar. I cannot say I don't want sugar. It's too late. Either you don't drink the coffee or tea, but if I want to drink coffee and tea, I have no choice. So I've been taking some sugary drinks since I came back from overseas. So what is my advice? So I think for those people, especially the mums and the people who make coffee for your family, or please go and advise whoever they make coffee and drinks for your family. Maybe just don't add sugar at all. right? Don't add any, what do you call milk, condensed milk for them. So let them add themselves. And then gradually, they might cut down the sugar, you know. So we are actually, as the RNC is going to have a campaign on sugar reduction and salt reduction, you know, surrounding areas and also the restaurants, okay? And also Malaysia is the eighth highest sugar consumption user in the world. Eighth, you know, Malaysia, which we are known for some good things, right? But we are actually quite good at doing certain things which is we are not so proud of. Anyway, we can improve. I'm sure we can improve as a nation. Okay, so what about the other healthy lifestyle? The other healthy lifestyle is by increasing your exercise, right? And actually, you don't have to go to the gym and pay a lot of money. And for those of us who have the gym, you know, membership, we also don't go so often. Why? I mean, to be very honest, right? By the time we finish work, we're hungry. By the time we have eaten something, we cannot go to the gym. And by the time you want to go to the gym at 9 o'clock, the gym is going to close, right? So we have the good intention, I'm going to the gym today, but end up we don't go to the gym. Anyway, CRNC, now we have this, you know, Wednesdays and Thursdays, we have exercise, you know, after work, dancing and singing after work. So that is, you know, give you some exercise, and dancing is also good. But what about something simpler, something everyone can do? In a KA block, in wherever you are, at home, you know, it's by stair climbing, walking upstairs, right? Stairs is free. Stairs are everywhere, right? Everywhere. So, and you can do it anytime, right? You can, you know, first thing in the morning, I will climb up from my LG floor to my 3rd floor. I already climbed 5 floors, so I feel very happy after that, right? And after that, every time you walk downstairs, you can climb again. So stair climbing is actually very important. And for those of you, you know, if you prefer gym, then, you know, 30 minutes of exercise every other day is good for you. Or you can just do brisk walking, right? Walking very fast, right? For those people who have got arthritis or some problem, you can walk, you know, at your own pace, but you still walk, right? So these are the modifiable risk factors, and of course, don't smoke, right? Can increase your other risks in addition to being diabetes, and of course, obesity. And Prof. Chin is going to give us a talk on obesity. I'm sure he's not going to disappoint any one of us, right? Obesity is also on the rise in the world. Malaysia is now the fattest country in Southeast Asia, right? And so more than half of the Malaysians are fat. Right. Okay. So that is also, you know, obesity and high sugar intake is also linked. You know, in the International Federation of Diabetes have now, you know, agreed with the evidence of sugar can cause diabetes. Okay. Now, okay, so we try to prevent it. You know, so if you can try to live a healthy lifestyle. But for those people who already have diabetes, I can see that the audience is a very young group. You know, you might not have diabetes, you might have diabetes. You know, for those people who are young, you tend to get the type 1 diabetes, that means you need insulin. And then for those people who are older, tend to get the, you know, the type 2. Actually, 90% of people have type 2 diabetes and 10% only have type 1 diabetes. Okay, we are not going to talk about management of diabetes here. So what if you have diabetes, or your family members, I'm sure, you know, some of you have family members have diabetes. What do you tell them when you go back? You know, it's too late. Not too late. No, not too late at all. You know, I'm sorry you have diabetes, but then you have to manage your diabetes, right? And how do you manage it? By keeping a good control. So by taking a healthy diet, no sugar, you know, eating healthily, fiber, all these things that you're going to hear later on, right? And then you have to monitor your diabetes. If you don't monitor, how do you know your diabetes is good or bad, right? And why do you want to have a good control of diabetes? Why? I mean, you know, sometimes the diabetics say, I feel good. Why do I have to, you know, check my sugar? I feel okay. But, you know, diabetes is a chronic illness. That means something you're going to have for the rest of your life once you have it. And it's going to get worse. It's going to get worse, unfortunately. So the treatment can control it, right? So you need to have a good control of diabetes. So what if you don't have good control of diabetes? Huh? What happens? Then you're going to get those problems, we call it complications. Actually, there are problems associated with long-term diabetes. So what are they? Anyone want to tell me? Any medical students here want to tell me what are the complications or problems of diabetes?
Maybe amputation.
Amputation? Heart disease, someone say heart disease? Anyone? Stroke? Anyone? Anything else? Sorry? Yeah, high cholesterol. Yeah, okay, but you haven't really mentioned something. Oh, where is this place? Blindness. Blindness. You don't want to get blind, okay? You don't want to get blind, and it's irreversible. So it can affect the eyes. And it can affect the eyes gradually, slowly, to a point you don't know. And one day, the person wakes up and is blind. And it's actually very high incidence in Malaysia. I was told that, some of physicians here and diabetologists here, it's actually very, very high, right? So you can get blindness, and you can get kidney trouble, right? And then once again, the blood test gets worse and worse and worse. You don't know about it until really it's too late. By the time the kidney doesn't work well, it's really quite late. Your kidney is already knackered, right? So by that time, some of the people would end up on dialysis, right? And the other one is like nerve damage, right? You cannot feel the floor, you've got pins and needles in your legs, and then you've got nerve damage. Once again, it's not reversible. That means go back, get better. It's going to get worse. Then, of course, you can get all kinds of skin infection, right? Because your sugar, right? The bacteria loves sugar. So, if you've got a cut, your blood is more sweeter than others. So then you can get infection. And then if you need surgery, Prof. Chin is going to tell you about surgery, I'm sure, because he's a surgeon. So if you have a surgery, the wound will take longer time to heal. Okay? And so of course, people with diabetes not only have diabetes. Once they have diabetes, their blood vessels are going to narrow quicker than the rest of the people. So when your blood vessels are narrowed, you are at risk. That means you have higher chance of getting heart attack. Once you get heart attack, similarly, you can get stroke because they are very similar, right? The causes are similar, right? You get narrow blood vessels, get blockage, then you get the heart attack and the stroke. So actually, diabetes is not something you want to have, okay? So I think today, we hope you learned something from this World Diabetes event. So enjoy yourself. But one thing I want to say is that sometimes people say diabetes mellitus. That is a medical term, and actually most of the doctors don't actually use diabetes mellitus. We just use diabetes. When you say diabetes, you know what it means. So when you read something and it does mention diabetes mellitus, it means the same thing. Okay? So thanks for coming, and I hope you all have a good, productive day and enjoy the healthy food that is provided outside. Okay, thank you.
With much honor, we would like to call upon Prof. Dr. Chin Kin Fa, a clinical professor, to give a talk on obesity and diabetes. Let's welcome him with a big round of applause.
I can see that today, this morning, the audience doesn't really represent Malaysia. It seems more like Sungai Long. And how many of you are medical students? Please put your hands up. Only two. Only two. Okay. I'd like you to pass messages to your colleagues that in the future, if there are any talks given by your professors, please do turn up, because it's extremely highly likely that I might ask the same questions during the exam. Correct, Prof. Shelley? Yes. Okay. How many of you are science students? So quite a fair number. Arts? Okay. Anyone who are not students? Great stuff. That's what I like to see. Right. Okay. As you can see, I actually represent the Asia Pacific Metabolic and Bariatric Surgery Society for the whole Asia Pacific regions, representing Malaysia. So what we are interested is in the treatment of obesity and diabetes. How does it come about? As you can clearly see, that obesity is indeed an epidemic. And even if you look at America, all the kids are fat, and they are doomed to be fat for life. 6 billion kids at that time, many years ago. And if you look at the statistics, by the year 2030, all the Americans are going to be fat. And therefore, we call America fat land. Is there another fat land in Asia Pacific? Yes. Malaysia. You will be very, very surprised. Let me show you some data from Malaysia. And if you look at the causes of obesities, these are the 3 main causes. Genetics. They are born to be fat. There's nothing much you can do about. But look at this. The 2 main components, the behaviors and the environment. Behavior means, are you going to use the staircase? For those students who come across the road, don't jam the lift. If you are going up to the floor number 5, use the staircase. Unless you are the vice president or president, then use the lift to the 10th floor. They walk also, you see? So that is behavior that can be modified by examples, okay? And the environment. Later on, I'm going to show you a video. And if you look at me in the video, there was a few years ago when I consumed sugar. And then you look at me now, which is at the time when I'm not consuming sugar. Have a comparison later. So that is the environment. Look at the KFC, McDonald's. Over the years, in the past, when you go to a McDonald's, you only get a small burger. Now food are becoming cheaper, so they give you a big one. Then you saw the big burger and said, oh, how lucky. 5 ringgit, big burger. I must finish it, all right? And the chips are getting bigger. And the Coca-Cola is getting bigger and bigger as well. So that is the environment. But if you become fat, most of you are very happy that you're not fat. But if you become fat, look at the complications that you might have. Of course, diabetes is the main cause for the death in this population. Chronic heart disease, fatty liver. Most of us have fatty liver. And you would thought that someone like yourself from India, in origin, you may thought that I do not have fat. Right? Did you stand up for me? Right. Okay. Do you think she would have fat? So if you look at the similar person from the West, right, and of the same size in comparison, unfortunately I don't have any masala here, but if you stand them together, right, of the same size, same weight, same height, okay, you thought that their fat distributions are the same. But in fact, in Asia, it's different. We put on more fat. Where do we put our fat? In our liver, in our abdomen. So we all have big belly, right? So that is how we put on fat. And that is why in our population, that although we don't look that fat, but in fact we are very, very sick. Because inside our body we have a lot of fat. And that's why if you are tall with the same weight, you are okay. But if you are short with the same weight, you are not okay because your BMI is very high. And as you know, the higher your BMI, the more likely you are going to die. Alright. Okay. But I can tell you a trick that for some reasons, for some unknown reasons, that I can actually reverse that. Do you believe that? Yes. Okay, I'll show you later on. What about if you are fat? You feel that you are isolated? For example, from this group of audience, most of you are not fat, but maybe for those young girls there, a number of years down the line, maybe a few babies, then you become fat. Is that true? Right. So, the fatter you are, the more likely that you're not going to be employed. When you go and see it, when you go for an interview, right? If you are fatter, then the chances of that is that you're not going to be employed. And of course, because of that, you feel depressed, you don't have self-esteem, and that affects the sexual life as well. But I have patients who come to me and say that, how can I have sex? I can't even see it. Right? So that is a fact of life. So, and of course in this part of the world we talk about ringgit, right? Our ringgit is going down and down and down, right? But our population is getting fatter and fatter, right? So, the more fatter you are, the more likely you are going to spend money on your health care. So, for future investments, use the staircase. Don't jam the lift, okay? And if you look at the local data from the teaching hospital where I worked before, in University Malaya, and we look at, it was in 2009, when I first just came back from United Kingdom, and I collected data on 500 consecutive admissions to hospitals. And so I was surprised, you can clearly see that about 10% of those patients were classified as morbidly obese. In other words, they are very, very fat. And 30% were overweight. And this is a Malaysian population. Well, I don't need to say anything. You saw the arrow. It went up and up and up and up. I can't show it. It's way up. And you can clearly see that this is our country data. 43%, almost half of our populations are overweight. And this is the chart. You can clearly see that. This is the normal weight. This is malnourished. It's not bad for a country. We are not poor. We are quite rich. But in a few years' time, I'm not sure about that. But in fact, if you thought that if your country becomes poorer and poorer, your population will become thinner and thinner. Is that right? No. No. The more likely when the population becomes poorer, they are going to buy KFC. They are going to buy McDonald's for their dinner. They're not going to have a nice, what the dietitian said, a proportionate meal with all the vegetables and all the nice lean meat and protein. So they're going for cheap food. And the moment they go for cheap food and Coca-Cola, then their body weight increases. And that reflects in our tummy. So, in Malaysia, we found that if you are female and you are from the populations of Malays and Indians, you are more likely to be fat, especially if you are a housewife. And these are actually my patients. You can see that this is a very famous lady, is our registrar in University Malaya, right? She was like that, okay? and at the age of 65, and 1 year later, she was like that. I did some magic, okay? So, if you look at the diabetes, and this is our young age group, which reflects in our audience here, it's not bad, 2.4%, but it's still there. But as you get older, your chances of getting diabetes increases. And this is Malaysia, right? That's why you have Diabetes Week. I just came back from Singapore last week. They also have a Diabetes Week as well. And I was invited to talk about what I'm going to talk about. And you can clearly see that every one of us are very worried about the trend of diabetes. It's going up and up. And in 2008, there is probably the latest data that were collected by multiple institutions across the country. And we found that the obesity incidence has gone up. But in parallel to that, we also found that the diabetes has gone up. So you can clearly see that. Is this quite similar to the increase in obesities? So they are quite similar. So of course we now know that the reason why diabetes goes up in our country is because our population becomes fatter. And of course, there are some proportion of our population who are undiagnosed in the community. We don't know about that. So this is even more worrying because it means that there are more people actually having diabetes. So if you look at this, we do have a high prevalence of type 2 diabetes, and this is in parallel with the increasing prevalence of obesity and overweight. And of course, the younger population are getting more and more common. And if you look at the world projections, it's not only restricted to Malaysia, this is across the world. So you can see the percentage of increase of diabetes. And of course, in India, it's 108% increase, but in this part of the world, it's 76%. So we are not bad. It's all together here. Everyone suffers. But the Europeans are not bad, you know. You see, those are the rich country, you know. They were educated. They know how to eat. They know how to exercise. But we don't, right? That's why. And if you look at the estimates of the diabetes in 2007, you see this is Malaysia. The darker it is, the more common it is. Okay? Look at that. And then look at that. And then look at that. 2025. We become darker. Strange. In Malaysia, it's not in Indonesia, it's not in Cambodia, it's not in Myanmar, worse than India now. So that is Malaysia. So I think we need to tell our Prime Minister that our population has become fatter. What can you do about it? Right? And ask the wife. Yes, perhaps. We said surgery, the first step towards a more healthy lifestyle. Start living again. Right. Okay. So, if we have this problem of obesity, what can we do about it? Well, diet. There's a fundamental options that we can do. Exercise, staircase, behavioral therapy, change your behavior. Don't buy KFC. I'm KFC by the way, keep watching. Don't buy McDonald's. Don't take drugs. Drugs doesn't work, okay, at the moment. So what else can we offer? Well, this is the pyramid of treatment. Of course, we have an option of surgery. That's why I'm here. That's why I'm going to ask my students during the exam. But they are not here, apart from two. And if you look at this short-term therapy doesn't really work. So this is actually dietary management in green. And this, the one in pink, are the behavioral therapy, which means that you actually apply psychotherapy, you have counseling sessions, you will be encouraged and guided on how to eat, how to exercise, how to change your behavior. And during that time, your weight will come down. But as human nature, after a while, you start eating again. You become lazy again. And your mental state come back to the same again. So your weight goes up. So it doesn't really work on the long term. And we look at the only medication that's available there of some evidence of some use is Orlistat. But the amount of weight loss that they can achieve is very little. It's about 12 kilograms. It's not much. And eventually it all goes up. So, if you get fed up, you want to do something about it, don't shoot the weight. Okay? You just pretend. So, you must do something. Okay. This is my patient, 2007. He has diabetes, he has hypertension, he has sleep apnea. At night, he snores. And the wife said, I cannot sleep with you, I'd like to sleep next door. Okay? So all the time he sleeps alone. And there's the wife. Okay? After surgery, that's what he is. He was in 2011. And then he came to my clinic, very happy. And then he won an award because he became very confident. He became the best sales manager in the country because he can go out and talk. So, and of course, the wife remained the same. The main worries is that if he lost weight, the food all goes to her, and then she becomes better. That is the main worries. So, and more importantly, that this is what they take before surgery. And after surgery, they're no longer to take any medications. Of course, they still need to come back and see the doctors, but they do not need to take medications. And we know that from data in United States, that if you do an operation, overall, you can save about $2,000 per patient for every year. So there is a massive saving in terms of the medical cost. In the Asian population, as I said earlier, our fat distribution is different. So our selection criteria for surgery will be slightly different from the West. In that, for example, in the West, this would be about 35, BMI 35 and above, with high-risk health problems, usually diabetes or hypertension or sleep apnea, or BMI greater than 40 in the West. So in the East is different because our fat distribution is different. So at this point, I want to show you something. Let's have a break. Thank you. That's nice.
hope you enjoyed that bit called Slick and Chic, and we jump straight into Start Living Again After Obesity Surgery. And as you can see, all right, some interesting facts about it. Bariatric surgery, weight loss surgery, includes a variety of procedures performed on people who are obese. Weight loss is achieved by reducing the size of the stomach with a gastric band, or through removal of a portion of the stomach, or by resecting and rerouting the small intestines, a small stomach pouch, or a gastric bypass surgery. So
That's right.
that's exactly what we're going to be featuring right here on HOT for today. And in the studio, we'd like to introduce you to, of course, Doc on call.
Yeah,
Right?
we've got doctor on in the studio to tell us more about this post-obesity surgery. We have next to me Professor Dr. Chin Kin Fa, Professor and Senior Consultant Surgeon, Harley Street Group, and of course Nick Nora Hasfida, Nick Mohammed Hasnuddin, who's the patient, and we'll just refer to her as FIDA. Now FIDA, if you notice, this is FIDA, or rather this was
This is
FIDA.
before,
That's after.
that would be...
Check that out. I mean, seriously. I should get her to stand up. Fida, can you just stand up a little bit for us? There you
Fida
go. Awesome. So you've got Fida in here, and you've got Fida in the studios with us. Check that out. That's amazing. Oh. All right. And you're going to say CCK, okay?
I'm trying to figure out whether she's wearing the same floral outfit.
It looks like it a little bit this different color. Okay, 2282-857-8, 2282-8579. Give us a call, Malaysia, if you have any questions for the doctor. But meanwhile, let's jump right into it. What is this surgery that we're talking about? Now, earlier on we mentioned, how Dr. Oz on Oprah years ago talked about tying up the stomach. And he did something similar, reducing the weight of the patient, one of his patients. So are we talking about the same situation or same surgery?
Basically, there are three different types of surgery that we can perform. One is by using a lap band that you talk about, using a band to restrict the amount of food that will go through a stomach.
Right.
And the other one is FIDA, is a bypass surgery. So we go through keyhole surgery by making a small stomach pouch and then small intestine to bypass that to achieve the weight loss. This is a very important surgery because not only that it helps to achieve weight loss, it also helps to reverse the effect of the diabetes. So in many skin area where I work, we have a great interest in these procedures because of our research in diabetic patients. So we have a lot of patients who are morbidly obese, very big size, with diabetes, and after this kind of surgeries, the diabetes will resolve.
Wow,
so this is our current interest in this.
Now, cardiovascular diseases or symptoms as well gets resolved as well with this procedure.
With hypertension.
With hypertension.
Yes.
How interesting.
Yes.
Okay, I'm curious, Fida.
Yes.
We saw you here.
Yeah.
And of course, the caption here is staple my stomach, which of course you didn't do. So tell us a little bit about, what made you want to go through this, and how did you come up to the decision of doing this, as in, going through that surgery?
Because before that I had some problems about my body, had some problem with my spine, had some problem with my asthmatic, and then I just want to reduce everything so be healthy and play with my son. So I have 2 kids, and just I just take a risk to take a risk to do all the crushing procedures.
Fantastic. I have to say, you look adorable both ways. You look adorable, see me, so male, and now also so male, okay?
I'm sure it wasn't a sole decision on your own. What did Mr. Hubby say?
Wow, he's very
happy?
very happy.
But he was very supportive when you decided to go through the procedure.
Yes.
Okay. Now, doctor, coming back to you. Again, let's weigh this out. Now, for people out there who have an obesity problem, this probably is a good solution. However, there probably are people out there who feel this could be a quick fix to literally lose weight. Your advice on this? Because I'm quite sure people would look at it while health-wise, but also, looking at it in another manner.
Yes, I'm very worried about future Malaysia because the health of Malaysia suggests that we are going to become a fat country with the highest hospital.
We're a fat country.
We're going to be a fat country of 2015.
Okay.
And then we're going to have the highest prevalence of diabetes
Which is very true.
Yes.
Which is very true.
Because of that, I think we should look at the obesity problem seriously. But it's a pyramid of treatments, and we shouldn't look at surgery as a sole treatment. The best treatment still by and large by exercise and dietary. The majority of the population are still going through dietary and exercise. The still that has gone through as well. Okay. But it wasn't that successful. And when we look at some medications that helps the patients to lose weight.
Okay, I'm going to show.
Then we consider surgery.
I'm going to show another picture of Fida here. There we go. That's Fida, or that was Fida again. So we come here to what we see right now. For patients obese and ones with diabetes, as Vida mentioned, she had back problem. These probably would be a very good solution. What does the procedure entail? How do you what happens when a person comes to you, for Vida for instance, who came to you and said, "Doctor, I need a solution to my problem. What can you do?" So if it is a person from outside viewing us right now, what would the whole process be like?
Well, first of all, he must come and see us, and we will have to perform a full assessment on his health.
Okay.
And we do have guidelines to look at. We have Asia Pacific guidelines to look at the body mass index, which is the weight divided by the height square. And it's, if the body mass index is greater than 37, then the patient will qualify for this kind of procedure.
Oh, I see.
If body mass index is greater than 32, there's two other health-related problems related to the obesity, then the patients can be qualified for surgery as well. So we do have a guideline to adhere to.
Okay. I have a question now. If I was 350 pounds right now, okay, I would be really big, and if I wanted to take up this procedure, this surgery, okay, and how long would it take for me to drop down, and how much can I drop? How many pounds can I drop?
Well, by and large, if you look at gastric bypass, you can lose about 70% of your excess weight, which is your overweight minus the ideal weight, excess weight that you have. 70% of that, 60 or 70% by gastric bypass. So this is kind of figure that we can work at.
Duration, please.
Duration, you usually can achieve that within a year. About a year. By then it will stabilize.
Okay, coming back to Fida, I'm curious. As everyone out there, I'm quite sure, would have many questions for you. Before I come to her, 2282 8578 8579. Give us a call. Talk to Fida. Talk to the doctor. Give us a call if you're curious about this entire procedure, and if there's somebody in your family or loved ones or someone you know who might benefit from it. Give us a ring. Fida, coming back to you, how was it for you post-surgery? Again, you had to go through the fact that you had excess weight taken off you. So how was it for you post-surgery? Were there any side effects that came in? Did you have to watch your diet? Is there, anything that you had to do?
My diet, everything, and no side effects.
No side effects at all?
No side effects.
Do you still eat and crave for the food that you like, your nasi lemak and everything?
Yeah,
You still eat them?
Yes, still
do.
eat. But I take a small portion from home.
Okay.
If I like to eat nasi lemak, I like to eat steak or everything. You can still enjoy the food, everything. You can enjoy.
Enjoy more now.
Yeah.
Okay, but how does it work? Because before surgery, you have a pattern of eating. You have this habit of eating a lot. But does this whole surgery or this whole method, it decreases your appetite? Does it?
Yes, that's because we made a very small stomach pouch, and the pouch stomach produce hormones that make you to have the appetite. But because you bypass that, your appetite actually goes down. So it's a satiety, which means that you feel full after you have taken small amount of food. That's all you need. I encourage our patients to eat small amount of food with high protein, nutritious food, so that you can overcome the problems of malnutrition.
Interesting.
Well, hold on to your horses. We do have a caller online. Good afternoon. Hello. Hi, who's online, please?
My name is Dato Haji Salim from Pahang.
Yeah, Dato. Thank you for calling all the way from Pahang.
Yes, I'm quite happy since this program because I'm overweight also.
Okay.
My weight is I'm 6'3", and my weight is 148.
Okay.
So I would like to know, first thing I want to know is whether can I go on this program, and second, what is the cost of it?
All right. Okay. Is that all, Dato?
And lastly,
Yes.
the durations of this surgery, how long does it take?
All right. All right, Dato. Thank you very much for watching us all the way from Pahang. Thank you very much. So there you go. He's 148, he's 6 feet 3, and he wants to know how much it costs and whether he's qualified for this, for the surgery.
Well, it depends on his body mass index.
BMI, yeah.
BMI, and he's quite tall, so I think his body mass index actually is not that high. So if he is 37 and above, then of course you will qualify for this kind of surgery. Then you can choose which type of surgery you would like to go for.
Oh.
But if he is less than 32, less than 37, then I need to look at whether he does have any serious health problems.
37 and age, that is.
Yeah,
Okay.
and age is also a cut-off as well.
Right.
We only look at between age 18 to 65. Because it is age more than 65, the benefit that you get may not be that much. Because by and large, any patients who undergo this kind of surgery and they successfully lose weight,
Yeah.
they can gain 10 years of their lifespan,
Wow.
additional 10 years.
Fantastic.
Because we do know that the fatter you become, the more likely that you die early.
True.
Yeah, that's why Frida is investing into the future.
Brilliant. Brilliant.
No, yeah.
I have a question because I've seen some cases, probably rare cases, where they were side effects, but not physically, but psychologically, where a patient would end up becoming very grumpy. Have you heard of any of this type of cases before?
We normally screen them with our psychologists because what we don't want is patients who eat for comfort. So if they cannot eat, which is very hard, they get really depressed.
Right.
So that will affect their lifestyle. So we do screen them through. So if they do have psychological illness related to eating habits, then automatically they will be qualified for the program.
Alright.
So it's a multidisciplinary group. That is,
Okay. Frida, for our viewers out there, anyone watching you and looking at you saying, my God, I inspire to be like her, what's the advice you could give our viewers out there?
The advice.
As a mom of two and as a housewife, as a wife, you know, how was it for you? Psychologically, how was it for you? Coming to terms to say, I need to do something with my body.
Because before this, I just asked you today. I tell you about all my health is, and I just want my health to be. Then I'm last thinking, and then I go to prof, they help me, and then I just make a decision with prof. How can I be sleepless? Then reduce my pain, reduce all everything, then make me happy and make my family happy together.
You're able to have a better quality of life. All right. Medication. Well, we are going to go for a quick break. We're not leaving the doctor, not letting go the professor. We're coming back to you. They're here. You give us a call. We'll see you after the short break.